Here is the foot. Has two surface, dorsal surface and plantar surface. In the dorsal surface, as you see, we have lots of tendons. You see here the tendons of the muscles that are coming from the anterior compartment. Here is the tendon of the extensor Hallucis longus and tendon of extensor digitorum. And here is the tendon of Fibularis Tertius. But deep to this tendon, you can see a muscle, the red one. It is called the Extensor Digitorum Brevis. Here is the Extensor Digitorum Longus tendons. The muscle is here, but deep to this tendon, we have the Extensor Digitorum Brevis. Extensor Digitorum Brevis, it's an unusual muscle because it gives a tendon to the hallucis. Here you see it gives a tendon to the hallucis, the extensor hallucis brevis. Here is the longus, here is the brevis, but it does not give a tendon to the little toe. So it has four tendons, 1, 2, 3, and 4. One for big toe. This one is for the second, third, and fourth toe, but not for the little toe. It's located on the superolateral side of the back of the foot, and sometimes it's visible under the skin. Here it's more prominent. Yeah, we can also see retinaculum. They are called retinaculum. It's the thickening of the deep fascia. You know, the fascia surrounds or encircles the muscles of the leg and foot, and some parts of the leg and foot, they are thickening and they make retinaculum. Here is the extensor retinaculum. It has two parts, superior extensor retinaculum. It's attaching to the tibia and fibula. And inferior retinaculum, it has a Y shape. You see here is the one stem and two branches. It attaches to tibia and fibula, and also attaches to the medial and lateral side of the foot. Here's a superior, inferior extensor retinaculum. And the synovial sheath are around the tendons of the muscles passing underneath this retinaculum. Retinaculum means retain. This retinaculi retain or hold the tendon and synovial sheath around the tendon. And we also have here on the lateral side, we have Fibularis longus and brevis muscle and tendons. So we have two retinaculum, superior and inferior fibular retinaculi. You see here, and they cover the tendon of the Fibularis brevis tendon and Fibularis longus tendon. You see here, it's passing or crossing the sole of the foot. So here is superior and inferior fibular retinaculi. And on the medial side, here is the medial malleolus. Here is a calcaneous. Between the medial malleolus and calcaneous, we have flexor retinaculum. We have just only one flexor retinaculum, two extensor retinaculum, two fibular retinaculum, and the medial side we have just one flexor retinaculum. And you can see the tendon of flexor muscles from the posterior compartment of the leg passing underneath the flexor retinaculum and goes to the sole of the foot. And deep to the flexor retinaculum, we have a tunnel which is called tarsal tunnel. And there is a mnemonic that can help you to remember the order of the tendons and vessels and nerves in this tunnel, which is called TOM, Dick An Hary. TOM is Tibialis Posterior tendon. So Tibialis Posterior tendon. Dick is Digitorum. So Flexor Digitorum Longus. A is artery, N is nerve. Hary is flexor. Can you see? Here is the tendon of the flexor hallucis longus. Tom, Dick, An Hary. Tibialis posterior tendon, D, digitorum, flexor digitorum. and A, artery, tibialis posterior tibial artery, N is tibial nerve, and Hary is Hallucis, Flexor Hallucis. Longus. And here is the plantar surface of the foot. The plantar surface of the foot, we have a thickening of the deep fascia, which is called aponeurosis. The structure of the aponeurosis is made up of the dense connective tissue. Underneath the skin, we have this thickening of the deep fascia, which is called the plantar aponeurosis. It attaches to the calcaneus, and anteriorly it attaches here to the base of the proximal phalanges. If I take the plantar aponeurosis away, you can see lots of muscles here on the plantar surface, but you don't have to remember the name of these muscles. They are called intrinsic muscles. We have extrinsic muscles of the foot. They are coming from the posterior compartment, anterior compartment, or even lateral compartment of the legs. And we also have intrinsic muscles. What's the meaning of the intrinsic? It means that the origin and insertion of these muscles are located into the plantar surface of the foot. That's why they are called intrinsic muscles, and they can help the extrinsic muscles to do some movements on the toes. Yeah, and we also, if I take some muscles, first layer muscles, between the first layer and second layer, you can see some vessels and nerves. We will discuss about the vessels and nerves later. Thank you.